Hello, this is Dr. Tony Joseph, and thank you for joining us today. We're talking about heart failure in America. It turns out heart failure in America is a huge problem. Heart failure in America has shown itself to be a very thorny problem. It's a chronic disease, it's a progressive disease, and it's incurable. The potential for increased human suffering is just tremendous. And it cuts right across a whole cross-section of Americana, individuals and families, young people, middle-aged people, and the elderly as well. In fact, heart failure is the only major cardiovascular diagnosis in America that's increasing in both incidence and prevalence. Remembering incidence is the number of new cases diagnosed, and prevalence is the number of people with the disease alive today. In fact, if you divide the total number of new heart failure patients each year by the amount of time there is in a year, somebody is being told they have heart failure every 53 seconds, 24/7. The result is we have 600,000 newly diagnosed patients with heart failure each year, and in America today, 8 million people have heart failure and are living with it. What we know is that heart failure in those over age 65 decompensates in virtually every patient. So this has become the -- reason for hospital admission in America today. And remarkably enough, it's also the #1 budget item in our federal inpatient healthcare budget. So it's gotten attention not only from the sickness and clinical side, but also from the financial side as well. The Colloquium has responded to the issues of heart failure in America in a very positive way. The Colloquium is a hospital membership organization. As hospitals join the Colloquium and become members, they begin to work together. And in tackling the heart failure problems of America, heart failure experts from Colloquium member hospitals are working together to provide care across the entire continuum of care. This means we have work going on in communities, community education, support groups, parish nursing, education of the emergency medical system, etc. Within our hospital domain, from early diagnosis, testing of the heart, all the way through ventricular assist devices and transplant is taking place in Colloquium member hospitals across the country. What makes the Colloquium unique as well is, since we are experts working with experts, and since we are a membership organization, in the clinician domain, we ask, how do we care for the caregivers? We're not aware of any other accrediting body that focuses so much of our time on the doctors, the nurses, the pharmacists, the therapists who actually have to deliver the care. These are people too. They have wants and needs of their own, and we need to support their clinical efforts as well as the hospital operational efforts as well. And finally, we have to start asking ourselves, what kind of care are we giving? And there's so much out in the peer-reviewed literature, and we find that the guidelines are historically old, and so compliance with guidelines is daunting at times when you're an expert and you know the guidelines are old, and yet if you don't follow them, the government puts you up in hospital compare, and that's a big negative. So the Colloquium recognizes guidelines, and we're willing to be respectful of the organizations providing them, but we also look to our experts who are literally the experts in the country on the subject matter, and we ask them what the current literature is saying and where is this going in the future. So going through the process, a hospital clearly becomes preeminent as they achieve the various milestones in our various 4 domains of community, hospital, clinician, and science. Those hospitals that are members who have done the work, have achieved the various milestones in the 4 domains, can become an accredited heart failure center or an accredited heart failure institute. To find out if your hospital is an accredited heart failure center or institute, visit us at www.thehealthcareaccreditationcolloquiuminc.com, THACINC.com. Thank you. This is Dr. Tony Joseph, and we appreciate your taking the time to listen to our message.